Well, let's find out about healthcare. I've got Richard Bird here from HPE, and HPE is involved in healthcare in a big way, saving lives.
Definitely saving lives. That's something that I often hear said, but we can actually make that claim. So what we've got on the booth here today, we're giving demonstrations around the future of healthcare, because we recognize through the people, we've got great people that work at HPE that have worked in healthcare and still work with healthcare now. So what we're doing at HPE is trying to understand from a patient and from a clinical point of view how we can help use technology to reduce the demand, otherwise known as allowing patients to focus on their wellness and health maintenance as well as their sick care, have a more efficient pathway through the healthcare system so they can get in and out faster, essentially. So really providing better care at lower costs that's more convenient both for patients and for clinicians.
Well, I make a lot of poor life decisions, so I don't think I'm long for this earth. So how would HPE help me as a patient then?
So there is a couple of different ways, and we've got some demos on the show floor here today. So we have really strong long-term relationships with a lot of the software vendors within the healthcare marketplace. One example is a relationship that we've got with Cerner. We're a massive electronic medical records company, but then they've also got some really clever things to do with AI. So sepsis is a really big killer in hospitals. I think the CDC in America was saying 1 in 3 people that die in hospitals have sepsis. With working in conjunction with Cerner, we can connect at-bedside medical devices with our networking company Agerbo. Cerner's software runs on the HPE platform, so it's secure, robust, always available, and Cerner has an algorithm that runs across all of that telemetry that's coming from the devices that can actually sense, based on a person's physiology, whether they're becoming septic or not, whether they're developing sepsis. And if you catch it early, the mortality rates are quite small, making healthcare more efficient and saving lives, significantly saving lives with that early detection of sepsis.
So when it comes to the actual clinical side, the hospital side, how is HPE getting in there then to help?
So again, we have networking within the hospitals that helps clinicians connect to the patient data at any point in the hospital. It keeps it secure, so we've got role-based access to that information, so the right people can get the right access to that data. It's performant as well, so we can get that data to them quickly. And also the platforms that this software is running upon, it also provides that more positive experience because the software is running more quickly. Huge 3D, 4D medical images, moving medical video, and delivering that to clinicians at a high resolution really quickly, but then also virtualizing some of the hardware underneath that. So making their systems more performant, whilst at the same time reducing the amount of investment that they have to have initially for everybody to have their own version of their hardware.
So you're actually saving money because everyone can use the same hardware in slices,
exactly.
so to speak.
Classic virtualization.
Yep.
Yes.
Very cool. So next time I'm in the hospital, which will probably be sometime soon, I should look for HPE logos, and that way I know that I might live a little bit longer?
Yeah. And when you're not in the hospital as well, because you remember what I was saying about getting people out into the community quicker or caring for them in their own home? The third demonstration we've got is exactly that. So keeping people in hospital is very expensive.
Yes. Being
able to send them into their community, reports show that outcomes are better, the patient's happier, closer to their family. But how does that patient still have the confidence that they're connected back to the facility and the caregivers that they do have? The other demonstration we've got here is an Internet of Things platform that can actually connect to something like a wrist-borne medical device, can collect telemetry from that device.
Like a Fitbit or something like that.
Exactly like that, yeah. So this connects to the cloud, sends all that telemetry, heart rate, footsteps, blood pressure, and it can do some really clever things. So with our machine learning algorithm, we can detect 1 of 7 different types of fall. So whether that's a person falling over from a standing position or even slip down in their bed in a really, suspicious way. Yeah. Again, that can connect to clinicians that are watching over those patients. So the patient can be at home, their family can feel confident that they're still connected to the clinical teams that they need to be connected to.
Observed and monitored.
Yes, really being taken care of 24/7.
So the doctor can know when I pass out at the pub. They can phone.
Well, they'll know you're there as well because there's location-based services.
Phone the pub. You got to wake them up and send them home. Well, Richard, thank you very much for giving us the lowdown on this.
No, thank you for your time.